Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists, hosted by John Papasturjo. John is a frontline community pharmacist owner, assistant professor at the School of Pharmacy at both the University of Toronto and University of Waterloo, and an internationally recognized speaker, author, and researcher. Today's guest is Filipa Costa. Filipa has practiced simultaneously as a community pharmacist and researcher. 3 years ago, she transitioned exclusively to academia. She is an advisor to the Pharmaceutical Society in Portugal and recently authored and co-edited a textbook about the implementation of pharmaceutical care. Join John and Filipa as they talk about the development of pharmacists' advanced scope of practice in Portugal and discuss strategies to involve community pharmacists in new roles within their practice. Listen in as they highlight Canadian and Portuguese pharmacist efforts in research and the Know Your Pulse campaign for atrial fibrillation detection. Pull up a seat and let's get started.
And we're back for another segment of the Pharmacists Are In. Today we're actually in Belfast for the 47th European Society of Clinical Pharmacy Conference. It's always great to get to these international conferences. Today I'm here with my friend and colleague from Portugal, Filipa Costa. Filipa, great to have you here.
Great to be here, John. Thank you for inviting me to come.
It's always, these conferences are always fun. You get to meet, people from all over the world. You get a sense for really what's happening across the world. A lot of similarities I find with Canada, but also a lot of differences. And it's for me, it's a great learning experience. I had a chance to speak at the conference, and I got a lot of good feedback on that. But today we're going to talk a little bit about some of the work we're doing at IPACT and that you're doing in Portugal specifically. But I thought maybe we'd start. Just tell me a little bit about yourself, your practice, kind of what you do.
Mm-hmm. Okay, so I've started as a community pharmacist when I graduated, and I've been working in community pharmacy for most of my life, I would say, until 3 years ago. I've always combined this with research and teaching in academia, and currently I'm only doing research and academic work, but I also work as an advisory for the Pharmaceutical Society in Portugal.
That's great. And I also noticed we were talking about it. You have a new textbook coming out as well.
Yes, I'm very excited about this. It's been edited with Filipa van Mil and Aldo Alvarez from Peru. And it's about the implementation of pharmaceutical care, the Clinical Pharmacist Guide. And we're very excited about the book because it has contributions from various experts all over the world.
That's great. And we see this wave of pharmaceutical care, pharmacy practice kind of evolving globally. How do community pharmacists fit within this in Portugal specifically? Is their scope of practice relatively advanced, or are they starting to move forward right now?
Mm-hmm. I think in general, the scope of practice in Portugal has always been quite advanced in European terms. Of course, there are countries like some provinces in Canada where you have some rights we don't have. For example, the prescribing rights, we don't have them. But in general, in European terms, I think we're very advanced. We've had health promotion campaigns for long. We also have pharmaceutical care programs in various disease areas. Now we've had, since 2007, the right to immunize patients. And now this year, 2018, we have a new legislation that just came up with the new rules that we have, and some of them include specific adherence programs for patients. And also now we can do HIV testing and hepatitis testing in the pharmacy, which is quite recent. Wow. We also have a pilot running where we're testing the distribution of HIV medicines in community pharmacies.
That's great. It seems like the scope is actually pretty advanced when I compare it to what's going on in some other countries. When I think of the work you do, and you're very involved in practice research, becoming also from an academic background, is it hard to get the community pharmacists to participate in that? Because for me, I think personally, I think it's an important part of moving the profession forward. If we've got to get more community pharmacists involved in practice research, helping to quantify kind of the impact that we're having. I think it was last spring that you guys had a kind of a practice research summit out in Portugal as well. So I don't know, what's your take on that? Because I find it's slow moving even in Canada to get pharmacists to participate in that type of work.
Yeah, sure. I mean, like in all professions, we have people who are, let's say, the outgoing,
Sure.
the ones that start faster, and then we have some that just get delayed. But I think the work that FIP has been developing in terms of the competency frameworks has been quite important. And in Portugal, for example, we've been using those frameworks and adapted them to our reality. And we have them for each area of practice. And within community pharmacy, there's one specific role which is related to the pharmacist's involvement in research. So many pharmacists are not really taking so much importance to this, but we have very good and active colleagues who are really trying to develop their own research centers, but not isolated. They're trying to create the links with academia so that then they can be partners and not just places where people go and collect information, because that's not exactly the way to do it, in my view, at least.
No, you're right on with that, because I think that's kind of one of the things we struggle with as well, being involved in both kind of community pharmacy and research. I find if you're just using the community pharmacy as a place to collect data, you never engage the pharmacists there. So making them more actively involved, more active participants. We've kind of dabbled the idea around the University of Toronto and Waterloo of setting up like a pharmacy practice research network or something where, you know, community pharmacists that are interested, they could kind of join this network, but they also have the university resources available to them. You know, we've never really got it off the ground. We have kind of a smaller version of it running right now, and it's been pretty successful, but you know, we've almost created our own network internationally now through some of the other work that we've done, which is, you know, I don't think that's ever been done in pharmacy before.
But also I think there's one thing that has been having some impact is the fact that in Portugal we've had continuous professional development for, I don't know, even over 13 years at least. So we need to get this a number of credits to be able to renew our license to practice. And traditionally, all the things that gave us credits were like coming to conferences and attending courses, the traditional format. But now you can also get credits for participating in research. And this can be calculated depending on the time you invest in recruiting patients, in following them up, and monitoring them in all the senses. So this is actually, I think it's going to be...
That's a really good idea. I've never heard of that. I mean, yeah, I could see that, you know, being very applicable in other settings as well, in other countries. I mean, if, you know, I think it's a good way to engage pharmacists for sure. I mean, we should follow up with you on that to see how that works, because I think that's something that maybe we could use as a model in other countries also. But you know, we actually met on a committee called IPAC, the working group. I know we've had other speakers on the show before from IPAC, but I think that's kind of a unique group as well, almost a network that started in the area of anticoagulation, but now it's given us the opportunity to meet pharmacists from all over the world interested in research, anticoagulation, but we've almost been able to expand that now and use the network for other things also. And I know you're really driving a lot of the kind of the practical research out of there. We both sit on the board together. And one of the big initiatives that was kind of your baby was the Know Your Pulse campaign that started a few years back, and it's growing. Do you want to tell us a little bit about that?
Sure. Well, I've always been very interested in research that feeds into practice. And because in Portugal we have such a long history of promoting public health campaigns and initiatives, and they have always led to advances in pharmacy practice. When I heard about this project, I was immediately interested in it. So this basically comes from a patient organization, the Atrial Fibrillation Association and the Arrhythmia Alliance, and they've been developing these awareness campaigns for decades now. They're very successful, and their main goal is just to raise awareness of arrhythmias and of atrial fibrillation in general. All these campaigns have been involving, patient organizations and physicians, mostly cardiologists. But to my knowledge, the pharmacists weren't really involved in it. So IPACT proposed this association that we would create a partnership with them. And our input would be to be starting these initiatives periodically. They do it twice a year, and we would do them in pharmacy-related venues. So we can have them in community pharmacies, in hospital pharmacies, in nursing homes, in daycare centers. So depending on the countries, wherever the pharmacist is active at. So we started this initiative in 2016, but we added a second goal because one of the ways the awareness works is by using the traditional way of exposing information. So you just tell the person what atrial fibrillation is about. And that's good, but it's not enough. Yeah. So what they've created is demonstration parts. So you take the pulse of the patient manually, which is something quite easy to do, but the pharmacist does this mostly to show the patient how he can do it in his own home. But then it may happen that while the pharmacist is doing this, he detects some irregularities. So we thought, well, we're not going to just waste these people that are identified. So then each patient that's identified and considered as a suspect, because obviously the pharmacist has a checklist where he will look at symptoms and rhythm and rate and previous medical history. He will ask for all of that. And if he identifies any irregularity, he then refers the patient to the physician so that he can then be further examined. In some countries, there's still the possibility of having a technology to confirm the pulse detection. This makes pharmacists more comfortable to refer patients, obviously, because they feel they have like a proof. Yes. And then it's easier to tell the physician, please do a 12-lead ECG to confirm this because I've detected this. So we started initially by involving just a few countries. In 2006, we had 5 countries involved. We had, Canada, Portugal, UK, Spain, and New Zealand. These were the first 5, but we were able to recruit above 1,700 patients. So obviously the partnership was very successful, and since then we've been contacted to be able to contribute further to this event. We had a detection rate of 1.4%, which is in line with published results. Right
in line. So yeah, that was the first thing I noticed. We were pretty much right in line with what you see in the literature, right?
Mm-hmm. Absolutely. So then we got enthusiastic about it and thought, let's do an upgrade. So in the following year, in 2007, we extended to 10 countries. We had over 120 sites, and we had over 3,000 individuals involved. The detection rate was slightly higher. It nearly reached 2%, but it must be stated that this will depends heavily on the confirmation from the physicians.
That's right.
And what we've seen, and this is the part where we want to improve and need to create stronger partnerships with the medical society, is that even if we refer patients, we don't always get a feedback. So sometimes we believe that patients may be diagnosed, but we just don't hear from them directly. So in some countries, this works better than in others. There are straighter bonds. For example, in Canada, works quite well. In New Zealand also. In Spain, it's more difficult, and in Portugal, it's more difficult. But still, because the system is slower.
Yeah.
So patients just need more time to go to the physician. Yeah. But we still get feedback. It's just that it doesn't go as easily. So one of the strategies we now have been developing to improve this is that we're trying to get other healthcare professionals on board the VIPACT. And for example, with the results of these two events, we have submitted a paper where we have as co-authors, the leader of this campaign from the patient organization, Trudy Loban, but we also have the chair of AF Screen, which is Professor Ben Friedman, and we also have a nurse who has been very active on this area, Liz Newback, and obviously all the people who were involved in really collecting the data in their own respective countries. So I think this is going to be improving slowly. Of course, there is some people who are skeptical and say, oh, you're now trying to diagnose patients. No, that's not what we're doing. Sure. We're exactly doing the same that we've always been doing with diabetes, with hypertension, with cardiovascular risk. So it's just that it's a new area, and that's why sometimes it's more difficult to...
Yeah, those individuals that are naysayers or have issues with it, I don't think they really get how accessible community pharmacists are. We're ideally suited for this type of screening because we see the patients more than anyone. They trust us. These newer technologies now make it so easy. I mean, I'm a data collection site for the project as well, and we use the AliveCore.
So in Canada, our experience has been really using the point-of-care devices, the AliveCore device, really helps to draw patients into the clinics. They like getting test results. I found as a method for screening, it generated quite a bit of excitement. I found, if we had an idea that someone could potentially be positive, we refer them off, and the physicians were pretty receptive to it, I think. And, I think my advice is anyone that's able to use it, able to do it using a device, it makes it quite a bit easier. But you were going to say, so we're kind of ramping up, I guess, for this year's campaign also?
Mm-hmm. Yes. We're preparing. So we're counting on the same 10 countries that we have involved in the past. So apart from those 5 I've mentioned, we've also included the Czech Republic, France, Hungary, and Switzerland in the second year. And now this year we're hoping to get also Brazil to jump in, which is going to be, because being a huge country, probably will give a very good contribution. Australia, they have had lots of experiences doing these kinds of events in the pharmacies. They were the pioneers in this, so hopefully they'll be able to join us this year. But also the Netherlands, because we also have a board member from the Netherlands, so he's probably going to join us, and Qatar. Qatar has already been willing to join in the former years, but because this event runs twice a year, and one of the times it coincides with their Ramadan, that makes it very difficult for them to be able to recruit people in that time of the year. But now in November, I think they will be able to also join us. So obviously there are many more countries we could reach, but we want to go one step at a time to be able to understand the difficulties that we have given the different cultures, the different pathways, the different functioning of the healthcare system, and even the scope of practice that you mentioned. And you were talking about the AliveCore before, but that's just to give you an example. In some countries, you don't have a LifeCore available. You may have Watch BP or other brands, but in some countries, not even those other brands are available. So that creates an additional difficulty. And in some countries, it's very awkward for pharmacists to be touching the patients. So these barriers exist, and we need to be able to come up with strategies in an efficient way so that we overcome them.
Yeah, it's truly become a global initiative. When you think of the scope now and the magnitude of the project, it really speaks to what we're able to do as pharmacists if we could get organized. We do have kind of, I guess, a common set of beliefs, and our ultimate goal is to improve patient care. But this is a great example how we get just, mobilize pharmacists from around the world with one cause. So I'm really excited about that. We have listeners kind of in multiple countries now. If someone's listening, they're a pharmacist, they want to participate, they want to include their pharmacy, how do they go about doing that?
Well, they can visit our website. That's www.ipac.org. And there's a section on upcoming projects, which is open to anyone. And then you can express your interest to join the project. If you feel it contributes to your practice, and if you feel you can also contribute to the network, you may also want to apply to become part of the network, but that's not compulsory. Okay. And also in the IPACT website, if you go to a section where it's called Know Your Pulse, you'll be able to see all the materials that have been produced. So originally they were developed by this patient association I mentioned, but then the major role of IPACT has been to be able to produce additional translations. So now we have the materials in many languages. I think I forgot to mention Hong Kong, so we also have Chinese in there, the traditional Chinese and the modern Chinese. So all the resources are there, like posters to display in the venues announcing the initiative. Then we have patient information leaflets, and then we have these like pull-out cards, which takes the pharmacist through the 4 steps of measuring the pulse manually. And then we also have videos to show pharmacists how to manually check the pulse. Of course, they are advised to go on specific training if they don't have it yet, because the education is not universal. But we believe this is some possible training for what we are setting up in this moment.
It would be great if we could mobilize our Canadian listeners. I know we have a lot of them. There's only been a handful of pharmacies that have participated to date. I think if we could get more and more Canadians participating, our scope allows us to do this. We have a LifeCore being very cheap. So for a clinical program, if someone's thinking about doing a point-of-care program that's simple, this is one that I recommend. The investment for a LifeCore is like $70 or something, so it's not a huge deal. You'd be surprised at how much traffic you generate to your pharmacy, and at the same time, you'd be helping a bigger cause. What are the exact dates? Is there a start and stop date for the Know Your Pulse campaign, or is it kind of open?
Yes. Well, it's always announced in the website, and this year it's for between the 19th and the 25th of November. That's like an entire week. This is the way we have to make it more impactful all over the world. But when I say we, it's the pharmacist branch. We are, of course, always very flexible. So for public awareness, we try to use these dates, but some pharmacies ask us, can we do 1 week later and extend this because our customers are liking it so much? And we see no problem in that, so we may extend it. We've done that in the past.
That's great. So if you're a pharmacist out there, go to the website, www.ipac.org. All the information is there. Let's try to grow this, make it into a really a popular kind of global brand, really promoting pharmacy practice. I think there'll be a lot of talk on social media as we get closer to the dates. But for Canadian listeners specifically, it'd be great if we had more pharmacies participate and really help push the Canadian initiative forward also. So I think on that note, it was great chatting with you today. I think always looking forward to see the great work that you're doing coming out of Portugal, and hopefully we could really have a huge impact with this year's Know Your Pulse campaign.
Let me just add something before we finish, John, because I think it's important, because we might have people from countries that speak different languages than the ones that we have represented already. So if that is the case, that's not necessarily a limitation. As long as you express your interest to participate, we then will make sure you get the translated documents in due time to have the campaign ready and, well, in a format that your public can understand.
That's very important. And, sometimes pharmacies service a specific ethnic group. So you may be in Canada, but you need Greek-speaking or Greek documentation that's translated to Greek. Those resources are available. So, not to be a limitation at all. Visit the website, reach out to the organizers, but we should be able to help you get on board. And I'm very excited to see the results. I think down the line we'll show that this has prevented some strokes. Great initiative. So thanks again for coming in. Enjoy the rest of the Congress. I know we got a couple of events tonight. It should be a good time.
Okay, thank you, John.
This podcast was brought to you by IPACT, the International Pharmacist for Anticoagulation Task Force. Visit www.ipact.org for more information.